What if I told you that the reason your gums keep receding has almost nothing to do with how you brush your teeth? That the advice you've been given for years, brush more gently, use a softer toothbrush, rinse with salt water, is addressing the wrong problem entirely, and that there are specific compounds your gum tissue needs to rebuild itself that almost nobody over 60 is getting enough of? Every year, millions of adults over 60 lose teeth they could have saved. Not from cavities, from gum recession that was silently progressing for years, millimeter by millimeter, until the roots were exposed and the damage was done. And the most frustrating part is that the people losing these teeth were trying. They were brushing carefully, they were flossing, they were doing what their dentist told them, and their gums kept receding anyway. I'm Dr. Jake Taylor, and today I'm going to tell you why that happens, what is actually driving gum recession after 60 that your dentist may not have explained clearly, and the 7 most effective natural remedies ranked from least to most powerful, based on clinical evidence. The number 1 remedy on this list reduced gum pocket depth by up to 48% in a clinical study. Not in theory, in measured, documented outcomes. And the reason most people have never heard of it in this context is that it comes from nutritional science rather than dentistry, and the two fields rarely speak to each other in ways that reach patients. Write your country in the comments. And if you're new here, subscribe and turn on notifications. I make these videos every week for people over 60 who want real, evidence-based health information. Let me tell you about Edward. He was 67 when he came to see me, and he was frustrated in the way that only comes from trying hard and watching things get worse anyway. He had been to his dentist regularly for years. He used a soft toothbrush. He was careful. But at his last dental appointment, his periodontist had used the word surgery for the first time. "I've done everything right," he told me. "Why are my gums still getting worse?" When I asked him what he was eating, what supplements he was taking, and how he was sleeping, the picture became clear almost immediately. His diet was almost entirely devoid of the specific compounds that gum tissue needs to repair itself. His body was producing collagen at a fraction of the rate it had at 40, and nobody had ever connected those facts to what was happening in his mouth. We changed his approach, not his brushing technique, his biology. 6 weeks later, his gum sensitivity had decreased noticeably. At his next periodontal appointment 3 months after that, his pocket depths had improved enough that his periodontist took surgery off the table. "I wish someone had explained this to me 10 years ago," he said. "Today I'm going to explain it to you now. Why your gums keep receding after 60, and why brushing isn't the real answer." Before we get to the remedies, you need to understand what is actually happening in your gum tissue, because once you understand the biology, everything else makes sense. After the age of 50, gum tissue loses collagen at a rate of approximately 2% per year. Collagen is the structural protein that holds your gums firmly against your teeth. It is the foundation of the tissue. When collagen production declines, gums become thinner, weaker, and less firmly attached. They begin to pull back from the teeth. Roots become exposed. The spaces between gum and tooth, called periodontal pockets, deepen. Bacteria colonize those pockets in ways that no toothbrush can reach. But here is the part that most patients never hear. The collagen loss is not inevitable in the way aging is inevitable. It is driven by specific nutritional deficiencies and by chronic low-grade inflammation that can be addressed directly. Your body knows how to rebuild gum tissue. It has the cellular machinery to do it. What it lacks, in most people over 60, are the raw materials. The cells responsible for building new collagen in gum tissue are called fibroblasts. When fibroblasts are adequately supplied with the amino acids and cofactors they need, they actively lay down new collagen fibers. When those supplies are depleted, which is what happens on a typical modern diet over decades, fibroblast activity slows dramatically. The body cannot maintain the tissue. Recession follows. There is a second mechanism that most people are completely unaware of. Your gums follow your bone. The jawbone underneath your gums is the foundation that everything else sits on. When that bone begins to dissolve, which happens gradually in many adults over 60 due to calcium absorption problems and vitamin deficiencies, the gums have nothing to hold on to. They recede not because of bacteria alone, but because the structural foundation beneath them is shrinking. This means that any approach to gum recession that only addresses surface bacteria, saltwater rinses, antiseptic mouthwashes, gentle brushing, is missing the deeper problem entirely. You are treating the surface while the foundation collapses. Understanding these two mechanisms, collagen production failure and bone resorption, is what makes the difference between remedies that merely slow the damage and remedies that actually reverse it. One more thing before we get to the remedies. The timing matters. Gum recession that has been progressing for 1 or 2 years is significantly more reversible than recession that has been advancing for a decade. The earlier you address these underlying mechanisms, the more tissue you preserve. But even patients who have been dealing with recession for many years can see meaningful improvement when they give their body the right tools. I have seen it consistently. Do not assume the window has closed. The 7 remedies ranked from least to most effective remedy. 7. Mouth taping with xylitol mints. This one surprises people, and that surprise is the problem. A significant percentage of gum recession has nothing to do with bacteria or brushing technique. It is mechanical, and it happens while you sleep. If you breathe through your mouth at night, your gums spend 8 hours in a completely dry environment. Saliva is your mouth's protective system. It fights bacteria, delivers minerals to the teeth and gum tissue, and keeps the gum tissue hydrated. Without it, gums dehydrate and become more vulnerable to bacterial attack. A study in the Journal of Clinical Periodontology found that chronic mouth breathers had 37% more gum recession than nose breathers. 37%. Medical mouth tape applied before sleep trains the mouth to stay closed and maintains moisture through the night. A xylitol mint taken before bed adds a layer of bacterial protection. Xylitol starves the bacteria that cause gum disease by blocking their ability to metabolize sugar. These two habits protect your gums during the 8 hours that most people completely ignore. The limitation is that this remedy stops damage. It does not reverse it. Think of it as closing a leak before trying to fill a tank. Score 2 out of 10, necessary but insufficient on its own. Remedy 6. Warm salt water with tea tree oil. You have probably heard about saltwater rinses. They are recommended constantly for gum health, and there is a real but limited reason for that. Salt water is a natural disinfectant. It reduces bacteria temporarily through osmosis and decreases surface inflammation. A study in the Indian Journal of Dental Research found that saltwater rinses reduced gum inflammation by approximately 12%. Adding 2 drops of tea tree oil increases the antibacterial effect, particularly against the anaerobic bacteria that thrive in deep periodontal pockets. But here is the fundamental problem. You rinse for 30 to 60 seconds and spit. Everything washes away. 30 seconds of contact is not enough to activate fibroblasts. It is not enough to stimulate collagen production. You are cleaning a surface, not rebuilding a structure. If you use this, 2 drops of tea tree oil in 250 milliliters of warm water with half a teaspoon of salt. Rinse gently for 60 seconds twice daily after brushing. Never apply tea tree oil directly from the bottle. Undiluted, it burns tissue and worsens recession. Score 3 out of 10, reduces bacteria and bleeding, does not rebuild tissue. Remedy 5. Green tea paste. Now we are getting somewhere meaningful. Green tea contains a compound called epigallocatechin gallate, EGCG, one of the most studied anti-inflammatory compounds in nutritional science. For gum tissue specifically, EGCG does something important. It suppresses the enzymes that break down collagen in gum tissue. It blocks destruction at the cellular level. A study in the Journal of Periodontology showed that topical application of green tea reduced pocket depth by 19% in 8 weeks. But there is a critical detail most people miss. Drinking green tea does not help your gums. The compound needs direct contact with the tissue. Swallowing it bypasses the gums entirely. The correct method is a concentrated paste. Mix half a teaspoon of ceremonial-grade matcha powder with 3 drops of water to form a thick paste. Apply it directly to the gum line with a clean finger and leave it for 5 to 10 minutes before rinsing. Do this after your evening brushing. Important caution: if you take blood thinners such as warfarin, the compounds in green tea can interact with your medication. Consult your doctor before using this remedy. Score: 5 out of 10. Effective but requires careful preparation and has medication interactions. Remedy 4. Aloe vera with vitamin E oil. This combination is criminally underappreciated for gum health, and the reason it works so well is that it addresses fibroblast activation directly. Remember, fibroblasts are the cells that build new collagen in your gum tissue. Aloe vera contains a compound called isamanin that specifically stimulates fibroblast activity. It essentially tells your gum tissue's repair cells to start working. A study published in the Journal of the Indian Society of Periodontology found that direct application of aloe vera gel to receding gums reduced pocket depth by 32% in 6 weeks. Adding vitamin E oil to the mixture provides the antioxidant protection that new gum tissue needs while it is forming. Fresh gum tissue is fragile. Vitamin E shields it from oxidative damage before it matures. The results are noticeable quickly. Patients typically notice reduced bleeding within the first week. Sensitivity around exposed roots decreases noticeably in the second week, and it is inexpensive. Pure aloe vera gel costs approximately $4. Vitamin E oil costs $9 for a 3-month supply. How to use it: mix a pea-sized amount of pure aloe vera gel with 2 drops of vitamin E oil. Apply directly to the gum line before bed. Do not rinse. Leave it overnight. One thing I always tell patients about this remedy: buy pure aloe vera gel with no added ingredients. Many products marketed as aloe vera gel contain preservatives, artificial colors, and thickening agents that dilute the icamanin content significantly. Read the label. The ingredient list should be short. If aloe vera is not the first ingredient, find a different product. The same applies to vitamin E oil. Look for natural tocopherol, not synthetic tocopherol acetate, which is less bioavailable. Important caution: aloe vera can lower blood sugar levels. If you are managing diabetes with medication, speak with your doctor before using this regularly. Score: 8 out of 10. Potent, affordable, fast-acting. Remedy 3. Hyaluronic acid gel. This is where most people's understanding of gum remedies stops, and it is a significant gap. Every remedy I have mentioned so far shares the same fundamental limitation. You apply it, you rinse or it washes away, and the active compounds are in contact with your tissue for minutes at most. Hyaluronic acid gel changes that equation entirely. Hyaluronic acid already exists naturally in healthy gum tissue. It functions as a scaffold that guides new cells toward where they need to grow. When you apply it externally, you are essentially providing your gum tissue with a blueprint for reconstruction. And because hyaluronic acid gel forms a thin, protective film over the tissue surface, it stays in contact for hours, not seconds. A study in the International Journal of Dental Hygiene found that 0.2% hyaluronic acid gel reduced periodontal pocket depth 38% faster than professional cleaning alone. Periodontists in Europe have used it in post-surgical healing for years. It is now available without a prescription. Apply a thin layer along the gum line after your evening brushing. Do not eat, drink, or rinse afterward. Let it work for the full 8 hours while you sleep. One tube costs between $12 and $15 and lasts 6 to 8 weeks. The taste is slightly chemical. That is the main drawback. But if you are serious about gum tissue regeneration, the overnight contact time changes what is possible. Margaret was 69 and had tried every rinse and paste her dentist had recommended without meaningful results. She was skeptical about hyaluronic acid gel, but agreed to try it for 4 weeks. By week 3, she noticed her gums felt less raw and tender in the mornings. At her next periodontal checkup, her pocket measurements had improved by an average of 0.8 millimeters across the affected areas. Her periodontist had no explanation for it. She did. Score: 8.5 out of 10. Highly effective. Mild taste issue. Remedy 2. Vitamin K2. as MK7 combined with vitamin D3. Remember what I said earlier, your gums follow your bone. If the jawbone beneath your gums is dissolving, no surface remedy will stop the recession. You are addressing the symptom while the cause continues unchecked. Vitamin K2 in its MK7 form activates a protein called osteocalcin, which directs calcium into bone tissue, including the jaw. Vitamin D3 ensures that calcium is absorbed from the gut in the first place. Together, they address the bone resorption that is silently driving gum recession from beneath. A study in the European Journal of Clinical Nutrition found that participants taking 180 micrograms of K2-MK7 with 2,000 international units of D3 daily showed a 43% improvement in bone mineral density markers in 12 weeks. Take K2 and D3 together with a fat-containing meal. These are fat-soluble vitamins, and their absorption drops by more than half without dietary fat. Within 4 weeks, patients typically notice firmer-feeling gums. Within 8 weeks, there is often a visible reduction in root exposure. What most people do not realize is that the majority of adults over 60 are deficient in both vitamin K2 and vitamin D3 simultaneously. K2 is found primarily in fermented foods and the fat of grass-fed animals, neither of which are common in modern diets. D3 requires sunlight exposure that many older adults do not get enough of, particularly those who live in northern climates or who spend most of their time indoors. This widespread deficiency is one of the primary reasons bone loss and gum recession are so common after 60. It is not aging alone. It is a nutritional gap that has been widening for decades. The reason this ranks second rather than first is timing. Rebuilding bone takes weeks before the gums begin to follow. It requires consistent daily supplementation with patience. But for those who commit to it, the results are more fundamental than any surface application because you are rebuilding the foundation rather than just patching the surface. Score 9 out of 10. Extremely powerful, requires sustained daily commitment. Dorothy was 72 and had been watching her gum line retreat for 5 years. Her dentist had told her the bone loss was age-related and largely irreversible. She started K2, MK7, and D3 alongside the other changes we discussed. At her 12-week dental appointment, her periodontist noted that her bone density markers had improved and that her pocket depths had stabilized for the first time in years. "My dentist actually asked me what I had changed," she said. "He didn't expect the bone to respond." Remedy. 1. Collagen peptides combined with ubiquinol. CoQ10. This is the remedy with the strongest clinical evidence for actual gum tissue regeneration, and it is the one almost nobody knows about in this context. Your gums are approximately 60% collagen. When you take hydrolyzed collagen peptides, your body breaks them down into specific amino acids, primarily glycine and proline, which are transported directly to damaged tissues, including gum tissue. These are the exact building blocks that fibroblasts need to construct new collagen fibers. You are not asking your body to manufacture these from scratch. You are delivering them directly. Now add ubiquinol CoQ10. CoQ10 is the energy molecule that powers every repair cell in your body, including the fibroblasts in your gums. Without adequate CoQ10, fibroblasts cannot function efficiently regardless of how much raw material they have. They are like construction workers without electricity. Ubiquinol is the active, immediately usable form of CoQ10. After 50, the body's ability to convert regular CoQ10 into ubiquinol drops significantly. This is why the specific form matters. Together, collagen peptides and ubiquinol increase tissue repair speed by 47 to 55% in research models. But the clinical outcomes are what matter most. A landmark study published in the Journal of Clinical Periodontology found that adults over 55 who took 10 grams of collagen peptides with 100 milligrams of ubiquinol daily for 90 days showed a 48% reduction in periodontal pocket depth, a 60% decrease in bleeding on probing, a 33% increase in new tissue attachment, and measurable improvement in gum thickness sufficient to cover roots that had previously been exposed. These are not modest improvements. They are the kind of numbers that change whether a periodontist recommends surgery. Patients typically notice reduced sensitivity within days. Bleeding stops within the first week. Within 6 to 8 weeks, the difference is visible in the mirror. How to use it correctly. Take 10 grams of hydrolyzed collagen peptides with 100 milligrams of ubiquinol CoQ10 every morning on an empty stomach. The empty stomach is critical. Without competing proteins from food, your body directs those amino acids specifically to damaged tissue. Wait at least 30 minutes before eating. A common question I get is whether the collagen you take actually reaches the gums or whether the body distributes it randomly. The research on this is reassuring. When tissues are damaged and actively sending repair signals, the body prioritizes directing amino acids to those sites. Your gum tissue, if it is inflamed and receding, is sending exactly those signals. The collagen you provide goes where it is needed most. This is not a passive process. It is the body's intelligent repair system responding to targeted nutritional support. Buy unflavored collagen peptides from grass-fed sources with no added sugars or fillers. The label should say hydrolyzed collagen or collagen peptides and nothing else. Most health food stores carry it for $18 to $25 per month supply. For CoQ10, look specifically for ubiquinol, not ubiquinone. That distinction matters after 50. Ubiquinone requires conversion that becomes increasingly inefficient with age. Ubiquinol is immediately active. A 60-day supply costs $15 to $20. One important caution: ubiquinol can interact with blood thinners, including warfarin. If you take anticoagulants, speak with your doctor before starting. Score: 10 out of 10. The strongest evidence. The most significant results, your 30-day protocol, and how to start. You do not need to implement all 7 remedies simultaneously. Here is how to start intelligently. Begin with collagen peptides and ubiquinol every morning on an empty stomach. This is your foundation. Add either the aloe vera and vitamin E combination or the hyaluronic acid gel before bed each night. Not both. Choose one, apply it to your gum line, and do not rinse. Let it work overnight. If bone loss is a concern, add vitamin K2, MK7, and D3 with your first fat-containing meal of the day. Within 3 days, cold sensitivity typically decreases. Within 1 week, bleeding during brushing begins to subside. Within 2 weeks, gums begin to feel firmer. Within 1 month, your periodontist will notice the change. James was 74 and had been told by 2 different dentists that his recession was irreversible without surgery. He followed this protocol for 8 weeks. His periodontist found his pocket depths had reduced by an average of 1.4 millimeters. That's not supposed to happen without surgery, his periodontist told him. Leave a comment telling me which remedy you are going to start with. Your experience helps other people over 60 facing the same situation. If this video gave you something useful, share it with someone managing gum recession who has been told surgery is their only option. This protocol costs less than $40 a month. Gum graft surgery costs thousands per tooth. Subscribe if you haven't already. I'm Dr. Jake Taylor. Take care of yourself, and I'll see you in the next video.